Yeah, that's a very good question, because now everything is going really fast. We have really strong results. We would like to see reproducibility in other randomized controlled trials, and there are trials that have started, but it will take a couple of years before we have the results. And also considering our study, the MASAI trial, we still have not assessed the primary endpoint, which is interval cancer rate. So the cancers that we did not detect, which are a very important measure of screening efficacy. We will publish results on this later this year. And then there's also a question of cost effectiveness, because these AI tools, they will cost. So we need to be sure that it's a method that it's acceptable also on a societal level. But the long-term effects, these early detections that we can enable with AI-supported screening, is this something that will be of prognostic significance? We need to have the long-term follow-up also to be able to really address this question. But then there are other practical aspects. When you implement AI in your screening program, you need to be able to monitor the AI tool and to be able to make sure that you have a quality assured screening programs. And but that's also something that's being developed now really fast. And we already have the possibility to do this. But then there's also a question, what will happen with breast radiologists in the long run when we use the AI? Will the competence or our judgment be deteriorate over time? I mean, the results that we show now in the MASAI trial, that was when AI worked together with the radiologist. Perhaps the result will look different in the in future if we are not as sure of our own judgment. But those are open questions that we need to look into.